of service to this country, and Lord, to be of service to mankind. Heavenly Father, as we have come together from various parts of the globe, we pray that you may lead us through the deliberations we are going to have this day and the next day. That, dear Lord, everything shall be led of you, and that, Lord, these programs that we are setting forth shall be successful, to the glory of your name and to the blessing of your children. For we ask all this in Jesus' name. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen. We may be seated.
Thank you, Dr. Roches. Can you please appreciate him with an applause? We need to keep ourselves warm. We can do it better. My team from the back, we can do it better. All right, we will warm up. It is okay. Thank you this morning. Standing in front of you is Dr. Gladys Osoro, the Dean of Students, who is going to be the MC this morning. And I want to also welcome my co-MC, Dr. Kenanda, to say hi.
Yeah, my name is Dr. Kenanda. Mine is to say hi. I think the next thing that we need to do is just to sing a national anthem. Just in the interest of time, we need to move very fast. Can we stand, please, and then sing the national anthem? Media. Sorry, please, the East African anthem, please. UK national. Thank you. You can be seated. I hope you all have the program, and if you look at it, we are several minutes behind, and we want to move. Now, this summit, although it's being hosted by Kisii University, the major prayer here is the School of Health Sciences. Because we are talking about Kenya-UK Health Alliance. So at this point, we may not do introduction, but I know as the visitors come to speak, you will get to know them just to save time. And at this point, I want to welcome the Dean, School of Health Sciences, Kisii University, to officially welcome the visitors and the participants in this special meeting. Dr. Igara Raymond.
Thank you, Dr. Maybe before I continue, maybe Gladys, you cannot recognize the visitors who are present. Before I talk.
Thank you. We want to appreciate the presence of our team from the UK. We have Professor Kerry John, kindly. Can you wave? We have Tim Davis. We have Joy Natalello. We have Catherine, kindly. Kilcoy, thank you. We have Dr. Mary. Welcome, thank you. We have Mary Law Brown from the USA. Marlon, thank you. Sorry for that mispronunciation. Then we also have our online viewers. We have Professor Graham Lord and Professor Keith Brennan and team. Kindly feel welcome. We also want to appreciate the presence of Victor Nyaganga, the CEO, Lake Region Economic Bloc. Where are you? Thank you so much. I wasn't seeing you. We also want to appreciate the presence of the Chair of Council, Kisii University, Dr. Mildred, the presence of our CEO of Kisii University, Professor John Akama. We want to appreciate the presence of the Vice Chancellor, Egerton University, Professor Kibuage. Kindly wave. Thank you. We want to appreciate the members of management from Kisii University, the deans. We also want to appreciate the great team from Kisii County. We want to recognize the presence of Dr. Kenani representing the governor, Kisii County. We want also to appreciate the presence of Jamil Shamil, who is the chair of Kisii Municipality Board. Thank you so much. We also have Monica Mochwewe, team leader, Swed, or she's yet to come. Thank you. We also want to appreciate the team from Kisii Teaching and Referral Hospital. We have Dr. Bahati. We have we have Dr. Ratemo. Thank you so much. We also have Dr. Omedo. Thank you and your team. Feel welcome. The other members present from the county, from Kisii University, our students, our deans, our directors, feel welcome. Our technical team, thank you so much for your presence here. We also want to, sorry, I've missed out on the name, I'm so sorry. Oh, sorry, yes, Dr. Kennedy Akomita, Director Sales Diamond Trust Bank, kindly wave at us. Thank you so much. And all people present, please feel free and enjoy every bit of this program. And may God bless you. Thank you, Dr. Professor.
Thank you, Dr. Gladys Osoro, our Dean of Students, Kisii University. The Chair of the Kisii University Council, Dr. Mildred Mudan, our Vice Chancellor, Professor John Akama, Vice Chancellor of Egerton University, Professor Isaac Kibwage, the CEO of Lake Region Economic Bloc, Mr. Nyagaya, members of the University Management Board present, our friends from the UK, ladies and gentlemen, please feel welcome. Good morning, everybody. Good morning again. Sorry for starting late, but a few hitches, but we've started. The nurturing and production of excellent health workers is Africa's hope, a continent faced with numerous health challenges, because health workers are watchmen over all the health and well-being of the people. For this reason, Kisii University School of Health Science, of which I'm the dean, is striving to produce no ordinary health practitioners, but a different crop of distinguished professional practitioners being built up in an environment of integrity and excellence. Our students know too well that ours is more of a calling where presidents and kings, the high and the mighty, and the downtrodden and the lonely are looking up to us for help and care. That is why we are equipping our students so that they will not just address the medical or health concerns of the patient, but also attend to the total well-being of humanity. And that is the reason why we have the Kenya-UK Health Alliance, having had 4 pillars, of which we are the 3rd pillar, which is having a center of excellence for health education and training, so that we can produce that kind of workforce that we are talking about. In the 21st century, we must adequately prepare our students to engage with the current disruptive and transformative technologies in the health sector. We're beginning to think about artificial intelligence, whereby robots are now operating patients instead of people, surgeons, and other forms of technology, and positively impact patient care. Excellencies, ladies and gentlemen, I don't need to say more. I'm sure you'll all agree with me that Kisii University deserves your support, and Kisii County and the Kisii Teaching Referral Hospital, which is the current training hospital, to adequately address the gaps in medical training and enable us to have the medical city that we're talking about in order to release into the medical field nothing but the best. Thank you for listening to me. Thank you very much. For now, I think I will welcome the chair of the Lake Region Economic Bloc, Mr. Victor Nyagaya, also to give some remarks. Thank you.
Good morning, ladies and gentlemen. My name is Victor Nyagaya, and I am the CEO of the Lake Region Economic Bloc, not the chair. The chair is actually His Excellency Governor Oparanya, the governor of Kakamega, and also the chair of the bloc, and also the vice chair of the bloc is His Excellency Governor James Ongwai, the governor of Kisii. Now, I want to take this opportunity first and foremost to welcome our partners from the UK, whom we have journeyed together on this project. I would wish to highlight, for those who do not know, that Kisii County was selected within the LRE block as the center of excellence in matters health. And so this cooperation that goes on between our friends in the UK and the Kenya government domiciled in Kisii County is not a coincidence. It is domiciled at the right place, at the place that all the 14 governors chose as a center to deal with health issues. And so when we gather here today, courtesy of Kisii University and the Kisii School of Medical Sciences, we are actually looking at how we will be able to work together, because we don't have another center of excellence of health in the Lake region. And we look up to Kisii County and Kisii as the focal point to disseminate what needs to be done. As you are aware, we have had a challenge in the past of COVID-19 and various other matters. And I must say here that Kisii has taken leadership in our meetings that we have almost on every Monday since COVID began, and even now. The Minister for Health, Kisii County, has taken her role seriously as the chair and leader, and has represented us in the block fairly well, even at the national level, on matters health within our Lake region counties. I am aware that our excellencies are supposed to be here, but they are also engaged, as you all are aware, that this is the times for electoral period. It's the electoral cycle in this country. And at this point in time, it's not quite easy to get our political heads gathered. The priority changes, but it's a short cycle. Within the next 1 or 2 months, we'll get back to normal and we'll be able to secure their spaces in such gatherings. So I want to take this opportunity to convey the greetings and goodwill from our excellencies, as well as the entire Lake region block counties that I represent. Thank you very much and feel welcome. And I congratulate Dr. here. We have had these meetings previously in Kisumu, here in Kisii, and we are excited to see that it is coming up and picking up and coming from its inception to become a reality. Thank you so much, Dr. Gara. Thank you so much, the Vice Chancellor seated here. Thank you very much.
Thank you very much, Mr. Victor Nyagaya. Now it's my pleasure to welcome our very own Vice Chancellor, Professor John Akama, to take over the program from here, and welcome the dignitaries. A coffee, clap for him. Yeah.
Thank you. Thank you very much, Dean Oigara. Our distinguished visitors from the UK, Tim Davis from Staffordshire University, Catherine Cadcon from Halda A Children's Hospital, Professor Kerry Jones from University of Fremont, Joy Natarero, Stafford University. I hear Monica was supposed to be a Monica Montessori from Swede program. Maron Brown, the CEO, Craydon Partners. Irene Satan, CEO, Global Tides Consulting. And also, we do have vice chancellors here, at least they are representative, but we do have the vice chancellor of Egerton University, Kibwage. Isaac Kibwage is with us here. We do have visitors who are with us online. We have Professor Robert Mokaya, the Vice Chancellor, University of Nottingham. We have got Professor Graham Lord, Vice President, University of Manchester. We have got Mr. Chief Dave, University of Manchester Foundation Hospital. We have got Dr. Nick Baz, the East London NHI trustee. Also, as you have heard, we do have representatives of our governors from the Lake Region Economic Bloc, represented here by the CEO, our brother Nyagaya. Feel very much welcome. Our chair of council, Dr. Melody Mudani, who herself, her training background is in the area of medicine, with a PhD in the area of tropical diseases. So, good morning. Good morning again. Distinguished ladies and gentlemen, we have got to acknowledge that we now have a very excellent opportunity to assist our government, particularly to achieve one of its major pillars, the pillar on healthcare within our president's Big Four agenda. In particular, we have got a unique opportunity to bring together our 4 universities, that is the University of Egerton, Maseno University, Masida Mulilo University of Science and Technology, and the Kisii University. We have also to recognize that we have here with us high level officials, as we have said, from the UK government. We do have high level healthcare experts, and we do have development partners. Here, I think we have heard that Kisii University is playing a central role, particularly in this summit, and in the long term, particularly in the development of the Center of Excellence in Healthcare Education and Training. And because of that, I will briefly talk, at least for the visitors, to know something about Kisii University. We are going to say that this institution started way back in 1963 as a primary teachers training college. And coincidentally, it was started under the sponsorship of the Kenya government and the British government. The government of Kenya eventually mandated Egerton University, we have got the Vice Chancellor here, to take over the primary college and develop it into a campus in 1994. On the 23rd August 2007, Kisii University College was established as a constituent college again of Egerton University. Finally, on the 6th February 2013, the college was awarded charter to become the 13th public university in Kenya. As we turn now, this young university has got a student population of over 20,000 students. Since being elevated into a full university, the institution also expanded in terms of academic programs, in terms of research, outputs, extension services, student enrollment, as I've already said, and staff establishment. Distinguished visitors, ladies and gentlemen, we are going to note that all of us have come from very diverse backgrounds with unique perspectives to help facilitate the success of the issues which have already been stipulated. Particularly in these interactions, we are hoping to particularly enhance potentials in areas of collaboration, extend aspects of networking among us as individuals and as representatives of various institutions, and also Kisii University being an academic institution, and we recognize here that we have got distinguished academicians in the area of healthcare from the UK. We look forward on issues of selling and eventually having long-term partnership in areas of pedagogy, areas of curriculum development, among other research and also innovation activities. Furthermore, with the expertise we have here, particularly people managing very successful hospitals in the UK, through this arrangement and even within this summit, we want to see whether we can be able to strengthen issues as concerns to healthcare systems. Obviously, what I've mentioned is not really a mean task. Ladies and gentlemen, it's our belief that through this summit, we are really aiming at creating an anachronism in our own societal situation. Particularly, we endeavor to have a positive deviation from positive deviation from our current situation with the potential of a huge impact to thousands, if not millions of people in the area of healthcare issues. Distinguished visitors, ladies and gentlemen, we need to improve on this. As already indicated, several institutions are strategically aligning themselves to promote the benefits of the Center of Excellence in Healthcare Education and Training. We wouldn't have chosen a better pillar to partner under with our various stakeholders. We have got to know that health is the most precious thing you can ever give a society or individuals. Perhaps most of us have experienced through our families and friends how different health crises have brought down and bankrupted many people. It is impossible to put a price on the value of good health systems, including well-trained medical personnel. When we started our meeting in Nairobi, one of the speakers towards the tail end of the meeting gave a particular statistics in terms of expenditure in healthcare personnel, in healthcare services, and you saw how skewed that global expenditure is. The United States, the amount of money it spends, when you put it globally, is more than 40% of the global expenditure on issues of healthcare services. And then we saw that other countries, their expenditure doesn't even reach 1%. So it shows the level of inequality in healthcare service delivery, and those are issues we people who are here as experts, as scholars, as policymakers, as development partners, we have to think about very seriously. Here we are talking about coming up with modalities in the long run of having equitable medical services for all mankind in the world. Our distinguished visitors, ladies and gentlemen, we have got to say, to give an example, in Kenya here, in Kenya we have got about 12 doctors for every 100,000 people, which is far below the WHO recommendation of 36 doctors for every 100,000 people. As a country, therefore, we have got to do better. Particularly, we have got to emphasize that this pillar of establishing a center of excellence in healthcare education and training will help us balance this equation in terms of the training of the requisite high-quality human resources. We have got again to emphasize that the above statistics are really worrying, and it is our opportunity and responsibility to help provide a better future for all mankind in the whole world. If I may quote the former president of the USA, Barack Obama, he once said, and I quote, "We did not inherit this heart from our parents, but rather borrowed it from our children. We need to return it to them better than it was when we borrowed it." In this regard, ladies and gentlemen, we have to gear up to bequeath the present and the future generations with adequate and well-trained medical personnel, facilities, and services. We have been deliberating even from the time we started our summit in Nairobi on issues of what is the way forward from this kind of very productive engagement. We have got to emphasize that today, this summit is a continuation of a remarkable journey and a wonderful partnership of institutions of high learning and also development partners and the people from the private sector from the UK and Kenya, with a common goal of developing a center of excellence in healthcare personnel training, research, and innovation, among other goals. It will be the nexus of change for many people in this region and beyond. It will also provide a chance for a better life to hundreds and thousands of people from near and far. To quite simply put it, it will positively transform our society. Our next step has got to be both practical and strategic. We should think about the future that is to come as we make decisions in the present. Apart from the training of high-level health care personnel, this project also provides a window, as we have already said, into the broader opportunity of vaccine development, pharmaceutical production in the region and beyond, and it promotes sustainable supply of health products and technologies, not only to Kenya, but to the whole of this region. Members, distinguished guests, we have got to talk about issues of resource. I think that's an issue which is probably is the elephant, in the room. We have got to agonize on how are we going eventually to move forward in terms of sustaining these very noble goals in the area of healthcare, training, service delivery, and many other aspects as it relates to health. As a university, we have got, plus our collaborators, our universities, Maseno, Masine, Murilo, and Egerton, we have already an MOU with the University of Manchester, and at the same time, there is this broader MOU of the Kenya-UK Health Alliance. We have already, through that arrangement, we have reached into the UK government through the UK Export Finance, and they have shown willingness of providing funding to the tune of not less than 50 billion shillings, which is quite some money, particularly in the development of a high-level university teaching and a referral hospital. But still, that arrangement is within, negotiation levels. Our government has got to provide what is known as a sovereign guarantee for these aspects to go through. And we are working with our ministries of education and the Ministry of Health to make sure that we are able to have that kind of arrangement. We really appreciate that. And I say that through this kind of engagement, I think we are going to come up even with more concrete way forward on many of these issues. So feel very much at home and very much welcome in this part of our country. Now, with those many remarks, allow me now to request my fellow brother, the Vice Chancellor of Egerton, to make a remark or two, and then we continue. Welcome, Professor Isaac Kiruage, please.
Thank you, Professor Kama, the VC, Egerton. I don't know why I like calling him the VC Egerton, Kisii. Madam Chair of Council, Kisii University, the VC, the CEO of the Lake Region Economic Bloc, the mayor of Kisii, I don't know where I went, Jamil. I normally call him the mayor. Our colleagues and the partners from the UK, representatives of both the Ministry of Education and the Ministry of Health who are here, and many others. So let me say, all protocols observed, ladies and gentlemen. I bring you greetings from Egerton University. Good morning. Yes, I'm very delighted to be here with you this morning to attend this summit. The journey to this summit started, okay. You know, we have different decibels between me and Akama, so can you increase the volume, please? I gave up talking very loudly a long time ago. So I expect people to keep an ear to what I'm saying. I'm saying that the journey that has brought us here started many years ago, in 2018 exactly, informally, looking at giving something back to Kisii. It was started by a group of Kisiis. One who's in Manchester. He'll be talking sometime late in the afternoon, Mr. John Guto. And we wanted to bring something about cancer treatment Our governor, His Excellency Ungwai, supported that, but it went to KU, teaching and river also. Then we said, well, that is gone, so what do we do? We said we need to loop in the university and do a center of excellence in human resources for health. The story is long, but after many discussions and the intervention by the VC and the governor, we eventually got an endorsement even from the president to do a center of excellence in healthcare education and the training. I'm telling you that because I've been working in the periphery and because this was expanded to the Lake Region Economic Bloc. So don't worry or keep wondering why is Egerton in the lake. You know, it is in the lift valley, isn't it, CEO? Now you understand how I come in. So, and I was asked, what would you like to have in Egerton? And I said, from here, then please let us have a center of excellence in respiratory diseases. So in this node and spoke model of operations and funding, we are a spoke to the Kisii hub. And we will be focusing on respiratory diseases. And I think the other universities have got their own areas of focus, but we'll be supporting this hub by focusing on that specific line of ailments, treatments, and training. Respiratory diseases, those of you who may have forgotten, you know, 2020 gave us a big surprise when COVID came. I call it a silent invader because it didn't think very much about borders. It spread across the world and it laid low both the rich and the poor. When you are struggling to breathe, there is no oxygen for the rich and for the poor, you need oxygen. And as we go forward, we're likely to get more episodes, more diseases of respiratory nature. And also, generally, our environment is degrading. Both indoors and outdoors because of industrial pollution. And we'll also, therefore, start observing an increase in respiratory illnesses. So we work together with the county government of Nakuru, whose hospital we use for teaching, and we are developing. And I hope that as our VC of Kisii has said, we'll get funding to realize this very noble undertaking, and then will become the referral place for any ailments. You know, these days, if you have really serious respiratory ailments, you are referred all the way to Nairobi. So as a center of excellence for respiratory diseases, Egerton is in Nakuru. Those of you who don't know, it is about 24 kilometers to the south of the Nakuru city, and the oldest institution of higher learning in the country, having started way back in 1939 as a training institute for farmers, and it continued evolving. It became a constituent college of the University of Nairobi in 1986, and in 1987 it became a full-fledged university. Currently, it has 21,000 students, of whom 1,350 are doing various medical courses. So when we have these centers, whether it is the hardware, whether it is the sport, we also look at the economic benefits that come with the communities of students, of trainers, of service providers. And for Kisii, that will be a serious contribution to the economy of the county. The same in the county of Nakuru. Ladies and gentlemen, as we continue to interact with colleagues from UK, we need to create partnerships, not simply for purposes of funding, but for purposes of exchanging ideas, so that our lecturers, we can exchange lecturers, we can exchange students, they go and learn, the others come here and learn the way we manage our health services. So as we train, we offer services, and we learn from each other, and we continually improve service delivery to those who require those services, which is our primary motivation in being in the health sector. I thank you very much for listening, and I wish this summit a great success. Thank you very much.
Thank you very much, the Vice Chancellor of Egerton University, for that wonderful brief. We have got the Dean, School of Medicine, representing the Vice Chancellor of Masino Muliro University. Is he around? Yeah, you want to say, come and say a word as we move forward. Sometimes, the only challenge is really tough. We'll manage. We manage. Welcome, my Prof. Welcome, Prof. Yes, please.
Sorry, just 1 minute. I need to get, okay. Starts coming. The chair of Kisii University, Dr. Mudany, the host VC, Professor Kama, our guest from the UK, professors in the house, scholars, leaders, all protocols observed. Mine is very brief. I just need to read a very brief statement from my Vice Chancellor, Professor Solomon Igosangwa Shibairo. Is unable to come because of an urgent council meeting in the university. Ladies and gentlemen, It's my honor for me to address this esteemed gathering of distinguished leaders, administrators, scholars, educationists, experts in medical education and practice, all protocols observed. This meeting comes on the heels of the national one, which we attended at the Safari Park Hotel, Nairobi early this week. And after attending several of these meetings, I wish to recognize the great initiative of His Excellency President Uhuru Kenyatta and the Right Honorable Prime Minister of the United Kingdom, which will improve medical education and healthcare in Kenya. It has generated immense interest in the country, the Lake region, Kakamega County, and Masinda Muliro University due to the huge burden of disease and associated poverty in the Lake region. Ever since the concept of the project hub and spoke commenced in the Lake region, Masinda Muliro University of Science and Technology has never looked back. It's an active member to ensure that the objectives of the national project, namely human resources for health development, research at the Ministry of Education to support affordable, accessible, quality, and equitable healthcare in Kenya are achieved to reduce diseases, deaths, disabilities locally and regionally, and to anchor our nation strongly in the League of Medical Education and Tourism, driven by universal health coverage, the Big Five agenda, and Kenya's Vision 2030. In this region, the hub and spoke model has attained an advanced level of cooperation, and with our UK partners, through the Ministry of Education and Health, the project strengthening approach calls for evidence-based, objective-driven, structured and participatory coordination and management. It calls for development of research and infrastructure for quality medical education and healthcare, which will lead to international healthcare standards in Kenya. There is immense goodwill from the two governments and the people of the two countries to fully achieve the project objective on time. And Masinda Muliro University of Science and Technology is in it for the long haul. The university supports these partnerships. It has already developed position papers on its three thematic areas, namely mental and community health and infectious diseases. It has developed a proposal for a baseline survey on mental health in the Lake region, and it plans to strengthen health information system in partnership with the county government of Kakamega to inform policy and action and to strengthen research, healthcare services in the Lake region and Kenya. Through these partnerships, the university, that's Masinda Muliro University, hopes to develop physical infrastructure to address quality academic research and clinical needs of its health-related programs in modern times. The university is thankful for the support it has received from the national government and the county government of Kakamega, the Lake region, and it looks up to the partnership with the UK to meet international standards of human resources for health development, quality healthcare, and research. Thank you.
Thank you. As you have seen, we adopted the model of the hub spoke model, probably which is the only one of its kind in our country, where you have 4 universities working together on a common agenda on issues of healthcare, personnel training, research, education, and innovation. And we are in cognizance members here that here we are working under the umbrella MOU, the Kenya-UK Health Alliance, which was signed by our President Uhuru Kenyatta and the Prime Minister of the UK, Johnson. So you can see that It is a very, very strategic kind of arrangement. But again, one thing I think I would again to say again, as much as we are talking about these very noble ideas of trying to say ideas on issues of healthcare, issues of curriculum development, staff exchange, fundamentally the elephant in the room is how do we fund all those activities? And I think it's important that in this today's summit, that we also look at those aspects of how we can sustain funding for this very, very noble idea. Now, I would like now to bring into the frontier our chairperson of the Kisii University Council. The Council of a University in Kenya is the highest organ of university governance. Our chair of the council is Dr. Medrid Mudanyi, who is herself is a highly trained medic from the University of Nairobi. She acquired her degree in pediatrics and her master's. And then from there, she went all the way to Japan, where she did a PhD in tropical medicine. As we talk now, our chair of council is basically involved on issues of healthcare. He is the chair of a number of NGOs dealing with the community healthcare issues and many other related aspects. So he's a very critical stakeholder of this arrangement. And in our country, the council is the one which guides everything related to projects and even financing. So I now call the chair, Dr. Milden Mudanyi, to come and make her remarks. Can we welcome her with a clap? Thank you, Chair.
Our distinguished guests from the UK, Tim Davis from Staffordshire University, Catherine Kilcoyne, Alder Hay Children's Hospital, Professor Kerry Jones, University of Plymouth, John Natalelo, Staffordshire University, Monica Moteshengwe, Deputy Team Lead, Suit Program in Kenya, Marian Brown, CEO, Clarendon Partners, representatives of our governors who are present from Kakamega County, Kisii County, Kisumu County, and Siaya County, and any other excellency governors from the Lake region present. Vice Chancellors, starting with our own Professor John Akama for Kisii University. We have heard from Professor Isaac Kibwage, Egerton University. We've also heard from a representative of Professor Solomon Igosangwa Shibairo, Masinde Muliro, was represented by Professor Kokonya. All the distinguished guests in the house, ladies and gentlemen, good morning. On behalf of Kisii University Council and the entire Kisii University family, I am pleased to welcome each and every one of you this morning to this summit. Today is a great day for the people of Western Kenya, for the entire nation of Kenya, and for the East African region as a whole. As it has been mentioned earlier, we are here to continue with the journey of establishing a game-changing project, a center of excellence for health education and training that will transform the health sector and ensure healthy lives and promote the well-being for all in line with our universal health coverage, as inspired by Kenya Vision 2030. The center will also address shortage of specialist healthcare workforce, training, and research. The summit today will assist to actualize our president's request. Our president, His Excellency Uhuru Muigai Kenyatta, he made a request to the UK government to establish communities of clinicians, researchers, and trainees in the UK and in Kenya, who will address the changing healthcare needs of Kenya and the neighboring regions, carry out research and etiology of non-communicable diseases within East Africa, develop treatments appropriate to the local population and disease, train a resilient and flexible multi-professional healthcare workforce for Kenya, and establish a clinical service that ensures high quality healthcare across all countries within all counties within Kenya. So I wish to thank the University of Manchester and other UK institutions for accepting to partner with us by allowing their programs in medicine, pharmacy, dentistry, nursing, and telemedicine to be licensed for use by Kisii University, and by extension, support the development of similar programs at Maseno, Masinde Muliro, and Egerton universities through a hub and spoke model. The Christie Hospital is also key in this endeavor by providing opportunities for training educator fellows. What a great opportunity to have a collaboration where there will be exchange of ideas, knowledge, and skills for the benefit of our great nations, resulting in a resilient healthcare system that can cope with changing disease burden, from infectious to non-communicable diseases, including cancer, mental health, and cardiovascular diseases. It is said that a candle does not go off by lighting other candles. And allow me to talk off cuff for a while of the written speech. You don't lose your light by lighting another candle. And so let us have the freedom to share the knowledge that we have with others. And so I'm really happy that UK is ready to share what they have with us. And in this, it will be a partnership, because even UK has something that they can learn from Kenyans. Now, when I was involved in training, at that time I was training at the Kenya Medical Training College. Professor told you I'm a pediatrician, but at that time I was training clinical medical students in a subject that was called lung and skin. So this time around, it was time to do dermatology. And so I took my students to train them at Kenyatta National Hospital. And when I made that move, I was blocked by the then head of that particular ward. And she said, "You will not train those students in my ward." And I asked why. And what did she say? She said dermatology is a subspecialty. It is a reserve of the few who have brains to learn it. And the students that you are bringing do not have the capacity to do dermatology. And I said, what a shame. Now, when you sit in your high position of privilege and you block others from learning, and because you are at that level and you're a dermatologist, who first went through undergraduate, then did postgraduate, then you did that as a subspecialty, and now you feel nobody else should do dermatology unless they go that route. Ask yourself, how many people do you reach in your high level as a dermatologist? How many Kenyans are you reaching? We have a population of over 50 million. How many do you reach when you sit in your privileged clinic where you charge consultation of 4,000 and you see at most 10 patients a day? How many Kenyans will you reach? My message is, do not block others from learning. They may have brains and don't look like at the level where you are, but please be a facilitator. Do not be a roadblock. When you light the candle of others, you do not lose your own light. You continue burning when others are also burning. And so we thank UK that you've come to light our candle, and as we continue burning, you will also burn, and together we will burn brighter. Thank you. So to our collaborators from UK, we welcome you to our beautiful country. And let this be truly that transfer of knowledge and skills. I must say that of late I've been a bit disappointed when I visit some of our health institutions, or I take my child or grandchild to the institution. Because what do I find? There is a doctor in front of me who asks, okay, so what brings you? Then you may say, okay, I have this cough, or I have this fever, or whatever. The next thing he or she takes 1 minute or so with you, and then writes something and sends you to the lab. And I'm like, really? What happened to the training that I received as a medical student? What happened to the training that I gave when I was a lecturer? Dr. Bahati, what has changed in the training of medical students? We used to start with history taking, then you went through the whole process of history taking. What are the presenting complaints? What's the history of presenting illness? What's the family and social history? You even inquired about the systems. So if it is cough, you didn't just send somebody to the lab. You wanted to know, is this cough respiratory or is it cardiovascular? And you check through all the systems. And at the end of the history taking, you came up with what is called an impression. This is my impression. And then you cared to write down what now is called the differential diagnosis. I think this is what it is, but it may also be 1, 2, 3, because they can also present them similarly. And it is at that point that now you send the patient to the lab based on that differential diagnosis. So you don't just send a patient and ask for 10 investigations because you never took history and you never examined. You are dealing with whatever it is, let the lab find it out. I just want some order restored, excuse me, in the medical world. And so I'm interested in the discussion of today. I'm interested in this Kenya-UK alliance. I'm interested in bringing back sanity, the medical profession. Let's bring it up. The professional thing that distinguishes us. So we are not just clerks. We are doctors. We examine and then we go to the lab after we have all the options. So that is just what I want to happen. And so I'm very keen on this Kenya-UK alliance as Kisii University takes the center stage to be the hub. And as Maseno, Egerton, Masinde Muliro become the spokes, and you have your areas of specialty. Kisii is doing cancer, Masinde Muliro is doing mental health, Maseno is doing HIV, and Egerton is doing respiratory. Shall we bring up the best and let it be truly a center of excellence? And so I'm excited about this Kenya-UK alliance because I'm looking forward to something different, not the usual thing, not what I've seen of late in our hospitals. We must bring it up and we are here to do it. And I take interest in this. Like Professor Kama, I'm actually considering jumping back to do the treatment of children. People are messing up with my babies. I can't take it. I can't take it. I'm going to sit back and start examining them. Look at their throat again. Look at their ears again. Because when is the last time the doctor touched the baby? When is the last time? So let's bring sanity. So we welcome this Kenya-UK Alliance. We want to get to that point of excellence. Let us exchange ideas. Let us exchange knowledge. Let us exchange skills and truly get ourselves there. When I was young, they used to tell me that sky is the limit. But now I know the sky is not even the limit because you can go beyond the skies. And we want to go beyond the skies together. So lastly, I want to just welcome you. Other than the business that brings you here, I want you to enjoy our hospitality, our great cuisine, our great people, and the land of Kenya that has diverse cultures. I want you to create time to visit our national parks, to see the big five, to see our great animals, to see what makes us tick, to see what keeps us alive. I want you, before you are done, to create time and visit the lakeside and visit the Mombasa beach for your holiday. So karibu Kenya, hakuna matata. Welcome. Lastly, I wish to call upon again the Vice Chancellor to take it up from here and move us in the program. Thank you very much. May God bless you. Amen.
Thank you, Dr. Mildred Mudai. Another round of applause to our. You can see Kisii University, we are very lucky to have a senior medical specialist as our chair. And you can see the passion that is in her. I'm sure we'll invite her next year when our medical students have reached 4th year and they are doing pediatrics. Chair will invite you to be an external examiner in pediatrics. Dr. Omedo is listening. Thank you, ladies and gentlemen. So this man has said it all. A set of excellence, so it will have to be excellence, not what is going on right now. Set of excellence in healthcare education and training, to establish a center of excellence for health education in Kisii University and the spokes, to establish communities of clinicians, researchers, and trainees in UK and Kenya who will co-develop those ideas that we are having. Ladies and gentlemen, this is our aim, and we cannot do that alone. We have to do that with the finance people, with the people of planning. And ladies and gentlemen, the next speaker is from the finance world. Kennedy Nyakomita, Business Development Manager, Diamond Trust Bank, will be the next speaker. Thank you. Clap for him as he comes back.
So good morning, everyone. To the dawns, all protocols observed. My name is Dr. Kennedy Nyakomita. I'm the Director of Sales at DTB. Dr. Mildred, you really touched me. I think you've really spoken from your heart. That whole issue of lighting somebody's light doesn't dim you. It's really touched me. And I think you raised some good points. When I was being trained, I'm not a doctor, medical doctor by profession, but when I was being trained, they always told us that as a good salesperson, you should ask great questions like doctors do. But it seems there has been a gap over time, and that's what you probably was highlighting. So as DTB, we are also here to seek partnerships, the same partnerships that you're talking about. And we are great in partnerships. We've worked here at Kisii County with the county governments. We work very closely with the private sector. And now these emerging partnerships, we want to be at the center of it. So for those who don't know as well, DTB is a public company. We are here in these countries. We are an East African player as a tier 1 bank, assets in excess of $4 billion. We have been here for over 75 years. So we are truly an East African bank. We are part of the Aga Khan Group. As you know, Aga Khan Group, we also have a hospital within the group, the Aga Khan University, the Aga Khan Hospitals, which is also, I believe, the single largest operator in East Africa. So we come with some knowledge around the health sector. And we also want to share, and these forums give us real opportunity to learn on how to partner with others. I want to say that we are in this county, and in the Lake region, we have 12 branches. In Kisii County, we are fairly entrenched here, and we've been serving the health sector. If you look at the large health facilities in this region, they bank with us, and also nationally. And we have been serving them fairly well together with the SME space. So if you want to know what is unique about DTB, maybe I can say 2 or 3 things. One, why are we attracting these health facilities? One is because we have a very strong IT infrastructure. So we can actually do a backend integration with those facilities so that they do their transactions not necessarily by coming to the bank, but at the comfort of their offices or at home. We do 95% of our transactions outside the bank. Only 5% of bank transactions are done within the DTB facilities. So we have a very strong IT platform. Number 2, we are a very capital intensive bank. We are a very strong bank. So if you're dealing with DTB, you know you are dealing with a strong player. Number 3, and the capital is in excess of almost 70 billion shillings, the equity from shareholders. Number 3, we are local, so we understand the local needs. So if you came here in Kisii County, we work with the county, we work with the health facilities, we work with the business people. We want to grow the health sector. Being local gives you that advantage. So we are proud and very proud to be here. But I want to say 2 things around the health space. One, the importance of it, I think, has been highlighted in the SDGs, has been highlighted with even the Big 4 agenda. And even at DTB, it's a priority item as a policy plank. So coming to participate here, coming to meet different stakeholders is one of the things we always encourage. We want to encourage investment in the medical space, in the healthcare space, in funding the equipment, in just engaging and bringing participants, stakeholders together. And we do this from time to time. We have training programs around it that help practitioners improve and also give them access to financing. So this is one key area that is important for us. So even going forward, we know the issues that are being faced. If you look at, for example, the government space, the greater burden of healthcare, as you know, is currently being carried by the county governments. Of course, the national government allocation onto the county governments. But looking at the landscape, the economic landscape, you will see that is going to narrow going forward. And the last thing you want to hear is cutbacks on health spending. Already it is fairly low, but with the tightening of the economic space, you will see more and more inability of government to finance the health space. And that's where we come in as banks. And that's where private sector participation is also required. So we come in as a party that can mediate and bring in private participants, to partner with government agencies, to partner with the universities, so that we can bring in finance, we can bring in some discipline around acquisition of medical equipment, so that we can serve our people well. So we are here saying that we need a space to participate, bring in PPP, and also to bring in direct private investments into the space, provided there is a good playing field. You can see, even if you look at total banks funding to the health sector, it is still maybe in the region of 5–6%. So why are banks not financing health institutions? It's a discourse maybe the Donzia can highlight, but we want to come in and we want to work with the county, the university, and the private sector in this space. So what are we offering in brief? We are offering what we have a program that currently is running with some hospitals. If you're running a private facility, maybe you have benefited from this program. If you have not, we invite you to do. So a lot of these facilities are owed money by NHIF or owed money by certain agencies, insurance companies, and sometimes it takes long. So we have a product called Supply Express, where these receivables from the facilities can be cashed at DTB. So if insurance companies are owing you money, you can walk in and cash this facility, cash these receivables from DTB easily. Number two, we want to fund those who are looking for equipment, to import equipment locally or import it from outside. I just want to say that there is available facilities, credit facilities, either through a lease program or straightforward loans, where you can tap in and get your facilities upgraded so that you can do the necessary investigations that Dr. Mildred was talking about. Otherwise, thank you very much, ladies and gentlemen, and I wish you a nice day. This is going to be a good learning program for me. Thank you.
Thank you for those good remarks. At this point, I think we need to move faster. As I said earlier, we are far much behind the program. We need to move fast so that we can be able to catch up. Now, allow me to invite the following to help us understand exactly why we are here. I'm told Monica Mosenko is here. I would like to invite you to make your remarks. Then thereafter followed by Dr. Kenani, then we will have Chamini, and then Marion Brown. You have 10 minutes to make your remarks on this so that we catch up. Thank you.
Good morning, everyone. My name is Monica Motshehwe. I'm from SWEET program. SWEET is in fully sustainable urban economic development program. And this program is being funded through UK aid, the British government, and we've been contracted by the British High Commission as Tetra Tech International Development, and is the managing agent to implement this program on behalf of British High Commission. So this program started in September 2018, and it's a 6-year program worth £70 million. And that money is mainly for 4 main components. One of them is development of the urban economic plans. The second component is on investment attraction. The other one is on capacity building. And the last one is on what you call investment climate, business economic reforms. So this program part of that money is going into technical assistance. Like I said, those 4 components, when you look at them, they all need technical assistance to deliver on them. And then there's some aspect of that money that goes into what you call the seed fund. Is a grant fund from the UK government to support 12 municipalities in Kenya. And maybe just to give a background information to that, when we started the program in 2018 September, December, we launched a call for proposal. And this call for proposal was for all the 59 municipalities in Kenya. Initially, the terms of reference for this work was to work with what we call secondary towns, about 6 to 10 of them. But then when it came to definition of the word secondary town, it became a little bit tricky. So since the municipalities were already in place, and there was another program by the World Bank called KUSP, we're able to now align or embed our program into municipalities, hence sharing with them that call for proposal for them to bid for the support from this program, because we could only support 10 municipalities of the 59. So what we did is we evaluated those proposals and we ended up picking 10. And Kisii is one of the municipalities among the 10 that we are supporting. And then along the way, because what we did is we're using the regional economic block approach to pick these municipalities. We had from the 10, you can see that 2 were missing. So the donor ended up saying, just add 2 from the lacking regional economic blocks. That's when we added Bungoma to join Kisii in this lake region. And then we ended up picking Wote to join Kitui in Eastern. And other municipalities that we support in the coast is Malindi and Lamu. And then when you go to the north is Mandera and Isiolo. You go to the North Rift is Eldoret and Iten. And coming this side, Bungoma, Kisii, Central, Kerugoya and Kathwana, and Wote Kitui. So those are 12. So the main purpose of this program, like I said, is to develop the urban economic plans, because urbanization is a new phenomenon in Kenya. So the UK government found it fit for them to come and intervene here and make sure that they support these municipalities to transform them from where they are to what we call intermediary cities. Our plan and our wish and our hope is that in the near future, all these municipalities that we are supporting, they end up becoming cities like Kisumu, Nairobi, Mombasa, and Nakuru. Fortunately, we are supporting Eldoret, like I said, and very soon we know that it will soon transition into a city. So what we are doing in here with this urban economic plan that we have developed for these 12 municipalities, in there is some projects or opportunities that are seen to be viable and bankable to transform the lives of the people in these municipalities. So that urban economic plan, once the urban planners are done with it, then we bring on board what we call investment attraction firms, the likes of Open Capital Advisor, the likes of KPMG and KCIC Consulting. Those are the 3 firms that we have contracted for them to now take this work on investment attraction as a follow-on to the urban economic plans to help these municipalities to attract investors so that they can now come and actualize these projects that have been identified in the urban economic planning. I will now narrow down to Kisii. Kisii, they are working with KPMG for 3 projects. One of them is the avocado oil processing, which we were launching on Tuesday, just this past Tuesday, and it was a successful launch. Another project is on banana fiber, whereby now we are going to use, or Kisii County and stakeholders are going to use the banana stem to come up with the fiber and eventually come up with the products that will come out of that fiber. So for the avocado oil, we have already through KPMG identified an investor. We are still looking for an investor for the banana fiber. And the third project is on integrated waste management. And I think all of you, you know that there is a dump site somewhere here. And then that dump site really is a health hazard to the people of Kisii. So this program, or I mean, this project of integrated waste management, its intention is to make sure that that dump site is being decommissioned to the new landfill, so that at least that is where they can do this sorting of the waste and making sure that they recycle and making sure that there is that circular economy or circular process in the whole aspect of waste here in Kisii. So that is the third project. In each and every municipality that we are supporting, the program will be supporting 3 projects each. But the UEP has got so many opportunities in there. And we will be working as the program with these municipalities to make sure that we identify other investors to actualize some of these opportunities or other development partners. And alongside those 2 components, there's capacity building. Capacity building is where we are now capacitating these municipalities, like, for example, for them to actualize this urban economic plan, they need to resource mobilize. So the one aspect that we have trained them on or capacitated them on is how to now come up with what we call own source revenue. And that aspect of capacity building, that is where I think now, having looked into the theme of this summit, is where I think our partnership and our collaboration can come into play, either with the interested investors that could be interested in some of the projects that are listed in the Kisii Urban Economic Plan, or other development partners that can now come in to do what? To finance some of those. And then other interested parties from wherever, to make sure that at the end of the day, within a short space of time, the Kisii Urban Economic Plan is actualized. So I'm here representing the British High Commission and SWED program, and to try to see areas of collaboration and partnership that may arise from this summit, so that at least together as partners or development partners, we can see how best we transform Kisii municipality beyond the 3 projects that we have already identified, or those that we have already engaged an investment attraction firm to work with them, because there is a lot in that UEP that needs resources. And resources, we know they are available somewhere. It's a matter of how. So I'll be here these 2 days to try to see those or establish those areas of partnership. And then I'll be going back to the office, report to the donor to say there is a gap here, or there are interested investors or partners coming out of that summit. Let's see how best we can partner and collaborate for the betterment of the Kisii municipality. Yeah, in light of those few remarks, I'd like to thank you so much for inviting us and giving us this opportunity. Thank you so much.
Thank you. Well said and heard. We want just to make an adjustment again. You know, when you are late, you keep on wondering how to go about it. Now, Dr. Kenani will come later after break, and will also probably represent the county. So I will just want to usher in Jamil to introduce Malo to make her statement. Thank you.
Bismillahirrahmanirrahim. I think it is still morning. So good morning, distinguished guests. My name is Jamil Shamji. I'm the chairman of the Kisii Municipal Board. I just want to quickly start by, first of all, looking at our visitors from the United Kingdom, because Monica talked about the avocado project. So this avocado project was a project that was launched 2 days ago, where the British government and the people of the United Kingdom, through support of the SWED program, actually were able to find a private investor who will be purchasing up between 50 to 100 tons of avocados every day and actually processing it into avocado oil and exporting it. Now, when I was listening to this, the chief officer for agriculture at that time during the launch mentioned that one avocado tree, if fully looked after and properly looked after, can actually educate one student through primary and high school. So we are now talking about this project helping up to 3,000 farmers. So if we say 3,000 farmers, I want to assume that each farmer has got at least 2 or 3 children. So we are talking about if this project, if it is properly managed, will help up to 10,000 students to get education. Some of them will then benefit from what we are talking about today. So I want to say thank you very much, and through you to go and say thank you very much to the citizens of the United Kingdom. That's the first thing. The second thing is 30 years ago, when I was in school, one of my professors told me that, I know a lot of students have challenges of asking questions because sometimes they feel that the question they ask is a stupid question. But the truth is that there's everybody who's waiting to ask the same question and is thinking the same way. I've been thinking a lot about what this Kenya-UK Health Alliance issue is. And then today I was looking at this. And then I was looking at this. And then I realized, okay, that is what it is really about. And I encourage all of you just to look at this. If you look at these 2 billboards here, you will understand why we are here. And it is really important and it will be transformative. Now, let me go back, and now let's go back to the municipality. So, Kisii municipality, we are hearing about a Center for Excellence in Health Education and Training in Kisii. Let's go to the next slide. I wanted to give you some context. This is the map of Kenya. This is the county of Kisii. So just put it in your mind and picture that. This is not very clear, but if you see the blue mark and the orange mark, you will see that this is the county. Kisii municipality is the small red portion in there, and that is what our boundary is. I just want to put it into context for everybody, and especially for the whole entire health, this whole entire health thing we are discussing. Let's go to the next slide. Again, let's put Kenya in the context of East Africa. Kisii is somewhere here. It's 50 kilometers from the Lake Victoria, and the Lake Victoria then connects Tanzania to Uganda. And then you have the lake region here, the lake region economic bloc there. So the question is that somebody was saying we have 14 million Kenyans in the lake region, but I believe it is not going to be only 14 million, but we will be able to take the entire north of Tanzania. You'll be able to even tap up into Uganda and Rwanda. So the catchment for the Kisii Health Center of Excellence is very big. So let's look wider and let's think a bit wider. Now we can go on to the next slide. So Kisii, I want to give you some statistics from Kisii. And these statistics are statistics that come up from the Kisii Urban Economic Plan. So in 2019, we had 207,000 residents. We are expecting that to grow to 300,000 by 2030. If you look at the population growth nationally and within the municipality, we are growing at 3.5% versus 2.4% globally, nationally. The working age of people who are residents in Kisii, 53% of the people living in Kisii are of the working age, compared to 45% in the county. And this is a demographic that you can take across the entire lake region. Look at secondary education. 54% of our people, of our residents have secondary education, 23% in the county, 23% nationally. So if you look at the other national urban areas, it's 37%. So investing in Kisii makes sense. It makes sense to come in and to educate. And I think Dr. Akama will confirm with you, even if you had somebody from the Kisii National Polytechnic, they will tell you that Kisii is already becoming a major hub in education. What is missing is health education. And now we're talking about health education. Okay, we can move on to the next slide. Some small one statement. From 2013 to 2017, Kisii County contributed 2.1% of the national GDP, making it the 15th largest contributor. So there are 47 counties in Kenya. Kisii was number 15 in that, and we are growing every day. So this is just something that talks about the potential of Kisii. You can go on to the next slide. Okay, so now we are here. Kisii is here, the municipality is here. I'm talking about the municipality. Why am I here? Why is the municipality here? We are here because we as a municipality are tasked with creating an enabling environment for people to actually carry on with their lives and to have an acceptable quality of life where they work, where they live, and where they will be raising their children. It is our obligation to create that environment. And that is why we are here. So we are now going to work on two major projects, which I think will give you the context as to what we need to do going forward. So the first one was what Monica talked about, the Kisii Municipality Urban Economic Plan. She talked about 4 different components. I'm going to focus on one component. You can go to the next slide. Okay, so Kisii, during the Urban Economic Plan, and it is important for everybody here to understand that this Urban Economic Plan was an expensive project. It is something that we as a municipality could never have afforded, okay? And why was it expensive? It was expensive because it involved almost 1 year of consultation with the residents of Kisii to understand what are their aspirations and what do they want to see Kisii to be like in the next 10 years. And they then took that and translated it into what they call an infrastructure plan. And what they said is that if you want to be ready to receive 300,000 people in Kisii in the next 10 years, there is a certain minimum amount of investment in infrastructure that you will have to do. And this is what it was, $91 million. $91 million for Kenya and for Kisii. I think those who are here know. It is something that could take us, if we continue the way we are, it will take us maybe 100 years to take that. And we need that in 8 years. And what did it say? The economic plan said, you need $91 million. You can source about $27 million from the county resources and from the national government. You can get 45.5 million from, private investment and public and private partnership. And, you can look for donor funding for this. So this is the component of the $100 million or $91 million of infrastructure investment that is required. It is not something that is a nice to have. It is something that we will have to do, because if we don't do it, then we are planning to fail. You go on to the next slide. Okay, what were the key areas of this $91 million? To create a ring road, to improve the streetscape, to bring in street lighting, come up with the integrated waste management project, develop markets, because any economy in Africa, you have small scale traders. You need to develop markets for them where they can actually do their trading. And with COVID coming in, almost all markets had to be closed. And this really impacted on the lives of the people. So we as a municipality are now challenged to make sure that the markets that we develop going forward are markets that are going to be COVID compliant, so that you don't have to close the markets in case this pandemic becomes an endemic. Energy efficiency, that is important. I mean, there's nothing you can argue about it. We need to improve the water and sanitation. We need to revitalize our rivers. We have 3 major rivers passing through the municipality, but because, of historical challenges, these rivers have been neglected and they could become a source of public health. But we can actually transform them and then make them a source of improved quality of life. Revitalizing the central business district, very, very critical. Everybody wants to be in the CBD. How do we improve the CBD? How do we come up with a transport master plan? Again, because everybody wants to be in the CBD, you go to think about the transportation. You talk about motorized and you talk about non-motorized transportation and you talk about organizing it. The final thing that the economic plan talked about was coming up with what is called an integrated strategic urban development plan. This is something that if you are a planner for a municipality or a county, it's the first thing you do. You come up with an integrated strategic urban development plan that tells you what do you want to do in the next 20 years? What do you want to do in the next 10 years? And what do you want to do in the next 5 years? And then you break it down to what you do every year. Then you take incremental steps towards achieving your goals. So I think this is what I want to talk about, the urban economic plan, in addition to the other things that Monica and the SWAY program will be assisting us. So let's go to the next slide. Now, I don't think you can see this very well, but these are some of the projects that were from the previous slide that were identified. So the ring road, the non-motorized transport, again, ring roads, sanitation. So already you will see that our governor actually internalized the urban economic plan. And in the last 2 years, through support from the national government, through support from international finance agencies, we have actually started the process of implementing and actualizing the urban economic plan. This is not a plan that we have taken and put on the shelves and it is actually gathering dust. We are making sure that this is almost the Bible for the Kisii municipality, and everything we do and everything we plan and all funding we get from any sources are channeled through the urban economic plan. And I want to challenge Monica that Kisii is the first municipality that is doing that. We can move on to the next slide. Okay, so we talked about an ISUDP. What is an integrated strategic urban development plan? And why is it so critical? Because this is what it says. It's a plan that provides a framework for future growth over the 10 to 20 years and is used as the main budgeting and management tool by the government, by the municipal government. So this is what will give us focus on what we need to do. What does it support? It supports development control, land management. How do you actually manage the land that you have in the municipality? It again gives you sectoral plans and area action plans and a clear implementation plan. This is very, very critical. Again, it has to have a strong focus on integrating the social, economic, cultural, and environmental divisions. Finally, it has to be participatory. And what we did is to make sure that the company that had the firm that had actually done the urban economic plan is the same firm that we engaged to do what we call our master plan, our special master plan. Can go on to the next slide. Okay, so where are we in this? The first thing we did was to go and delineate and get the boundaries of the municipality to make sure that these boundaries are done using the latest technology, latest digitized technology, such that you can actually understand, you can go and see what's 10 centimeters above the ground. And that is what we have. We are there. Today, we are here in our master plan, the urban economic, the integrated plan. We are trying to define a vision for future growth and development over the next 20 years for the municipality. So we are now doing public participation with the residents to ask them what do they want again on this. Then we will then provide an integrated overall strategic development planning framework for growth on the next 10 years. So we are at this point in our plan. And then once we have done that, then the next step is to develop the realistic implementation plan about the $91 million. And if we talk about the health city coming in, it will maybe go from $90 to 90 million to $250 million. And that is what we need to do. So my question and our question to everybody here is, we are here. Now we are talking about the Center for Excellence of Health. And this has not been covered into the strategic plan. We need to make decisions quickly. Do we cover that into the strategic plan? And if we do, then there's got to be a commitment that yes, we are all here, all the stakeholders will commit to do it. Move on to the next slide. Next slide. Okay, these are just details of what you do when you're scoping in terms of what you have you survey and then what you then do going forward. So we will come up with sector plans. We'll come up with a transport plan, an environmental plan, a disaster plan, a development planning policies, zoning regulations, capital investment plan, and implementation plan. Now, when we were talking about implementing that $91 million and looking for funding, there is somebody we've already engaged. And who will be speaking on that? We can go on to the next slide. This is the approach that we take. It's just for information, just to know that it is all inclusive, and we even include the vulnerable groups in our planning. Let's go to the last slide. I think this is the most important slide. Should the UK-Kenya Health Alliance Kisii Center for Excellence in Health Training and Education be incorporated into the ISUDP? Because if I want to believe that you will have hundreds, if not thousands, of people now coming into Kisii in the next 20 years. And if you have these hundreds of people, or thousands, there could be students, there could be medical professions, there could be, the other industries that are allied to it coming in. We have to plan for them. Okay, so what is the question? Is Kisii Center a presidential project? I think this was answered, right? If it is a presidential request, I believe then from Kenya, a presidential request is a presidential project for Kenyans. And as Kenyans, we must accept that this is a presidential project. The second, who are the major stakeholders that this project, and who will take responsibility and make commitments? Again, these are questions I think we need to answer today. Who are these stakeholders? How will these stakeholders collaborate with the municipality? How are you going to work with us to make sure that we put that in our municipality and we start making infrastructure investments that are aligned to what you want to achieve as the Center for Excellence? And the last question is, what will the next steps be at the conclusion of today's discussion? What are we going to decide on? What are we going to act on? Are we going to sign a memorandum? Are we going to do anything? Or do we just have our tea and coffee and then we leave? That is, to me, is the most important question. So I just want to say thank you very much for listening to us. This is a time to make action. Failure to plan is to plan to fail. Let's not fail. Let's not plan to fail. I want to say thank you very much, and I wish you all the best. The Kisii municipality and the Kisii County government is there, ready to work for you. Thank you very much.
Yeah, thank you, Jamil. I expected you to welcome Maron Brown, but nevertheless, I can do that. Thank you for the good remarks. Maron, please come and make your statement.
Morning, everyone. Can you hear me okay? Great. It's my great honor to be here in Kisii. I live in Washington, D.C. and traveled, been on the continent for about 10 days now, coming from West Africa here. I've been to Kenya a few times, but it's the first time in Kisii, and it's just wonderful to be here. And why am I here? And I wanted to just talk a little bit about my company, our firm, It's called Clarendon Global Partners. Africa Vision Partners is our Africa operating entity. And I got involved in this because someone from John Gutto's office reached out to us because of what we do. And let me just tell you in a nutshell what we do. My background is in investment banking, investment advisory work, institutional money management. I've been in that field for 30 plus years. Maybe it doesn't appear that way, but I date myself. But, and so someone from that office reached out to us because really what we're doing is our company was started about 7 years ago. We're focused on the continent. And what we do is really try to come together and help governments and stakeholders think about cities of the future. How do they build? How do they construct a smart city or a city of the future? You know, very quickly, I think everyone knows that, you know, in Africa, you know, our governments are, you know, we struggle because we don't have the resources to put into what's necessary for a city of the future. And it just so happens that Africa is the fastest growing continent in the world. So that is an issue. And so what we try to do is to bring together governments, private investors, stakeholders to build cities. So I'm going to tell you something. The infrastructure spend gap between what's required for infrastructure spend and what's required and what's available is about $70 billion per year on the continent of Africa per year. So that's the gap. You know, across the world, there's about $100 trillion of investable assets in sovereign wealth funds, pension funds, endowments, foundations that are looking for places to put money. The difference is, the gap is that sometimes we don't prepare the projects well enough for institutional investors to participate. And that's where we come in. So what are we doing? In a nutshell, if you look at the slide, we've just gotten to start talking with some of the planners. I met Jamil, John, had a great conversation with Monica from SWED. And what we're trying to help think through is incorporating the urban economic plan, the municipality spatial plan that Jamil just talked about, the smart healthcare city building plan, and the social realization plans with a funding strategy that helps achieve this city growth and this city development. So what we do, we come in and we try to help create these partnerships that creates value, and that we bring together, like I mentioned, global capital, the governments, for development partners, the stakeholders to really fund the growth that's necessary. Now, in Jamil's plan, he just mentioned that there is probably around a $91 million, let's call it $100 million of investments that's required over the next 10 years for that urban development plan. What we would suggest is that if you're thinking about building a new healthcare city, there's really no way to do that in an effective, efficient way without thinking about integrating the healthcare city with the urban development plan and the in the master plan that is for the municipality. Has to be integrated, and you stand a much better chance of raising the capital to do that. So if we go to the next slide. So I don't have a lot of time, so how do we do this? We do this, as I mentioned before, by partnering with the government, partnering with donor agencies. So you'll see some of the partners that we've worked with before. You'll recognize some of them: UKAID, USAID, the DFC, which comes straight from the Treasury of the United States, which is a development finance corporation. But to access that capital, you have to have a way to structure the plan so that they're interested. Exim Bank, Afro-Exim Bank, and then there are a number of private developers and contractors that we work with that would come in either with investment, know-how, technology to build it out. So That's how we do it. We can go to the next slide. This just talks about growth. There's one stat here that is quite interesting. 2/3 of the world's population growth will be on the continent of Africa in the next 100 years or so or less. So that gives us a sense of the need and why this work that we do is so necessary. Next slide. So when we talk about an integrated smart city, when I talk about that, I'm referring not only to the healthcare city, but the entire community and county, as we think about it, the municipality, the county, the new healthcare city that would be a part of it. So what are some of the elements that we're balancing and the challenges that you face there? So it's healthcare and well-being, training and education. We've been talking a little bit about that. That's critical because if you don't have the know-how and folks to operate the systems, it's just not going to be sustainable. It's not going to work. Technology and data, smart and sustainable city development, clean and renewable energy. It's almost impossible to finance anything today without it being environmentally sensitive and future facing in terms of low impact in fact, almost positive impact as it relates to climate. So that needs to be a part of the consideration in the planning and the structuring. Green constructions, waste management, and waste strategy. Monica mentioned that there is, that's one of the key plans that came out of their studies. The biodiversity and habitat restoration, land use. Then another one is leadership and sustainability. That it comes back to training, that comes back to social development, leadership development that takes and makes it sustainable. So, if I were to bring it all together, we can move to the next slide if you don't mind. So this is just a sense of what's happening in other cities around the world. You see what's happening there in South Korea, in the Kingdom of Saudi Arabia. A number of entities are doing this. We're actually doing this in other places on the continent. We're doing a healthcare city in Nigeria. We're doing one in Ghana. We have I've worked as chairman of the African Union Diaspora Initiative to think about healthcare cities in Southern Africa as well. So this is something that's not only, for Kisii, but it's actually taking off across the continent. Next slide, please. So the vision for the new healthcare city, I'm not sure this captures the entire vision, but it's to deliver a city centered around world-class healthcare, education, innovation, and triggers economic transformation of the city and the county. So the healthcare city can be a key trigger for the entire economic transformation of the whole Kisii region. Next slide, please. As I mentioned, some of the things we mentioned before, a logistics park, for example, that's just another thing that may come into that's maybe I haven't seen in the SWED development, but there's some things that would come out of this that requires and would attract other types of investments, an energy park, waste management we mentioned, agri-industries, educational institution and new innovations related to education, hotel, conference centers. There's a lot of things that come out when you start to think about putting together an integrated plan to build a smart city. So this is not different than what SWED is proposing. It just takes it and integrates the plans and integrate it for the entire county. It's a little bit about some of the futures of cities. Next slide, please. What does a smart city entail? It makes our cities more, using technology to make our cities more efficient, livable, sustainable, clean, by incorporating technologies and other innovations to make that happen. Next slide. So this is just an outtake of a project that's similar to Kisii that we're working on. What are some of the outtakes from the plans that we developed? Save water, reduce commutes and congestion in a city. which also helps the environment, also helps people in terms of their productivity, reduce the disease burden. That's part of the healthcare focus, faster emergency response, reduce crime. I don't think that's so much of an issue in Kisii. I did not hear that. And then, of course, to do it in a net zero carbon environment. So in this, and this is our last slide, I promise, the the outtake from that investment, which we think is probably a little larger than what we're doing, which we would do in Kisii, is kind of 10,000 students would be created, would be facilitated, 475 million in real estate investments, 10 to 12,000 jobs, 200 million in investments in healthcare, dwelling units. You can see that there are many values that come out of it. There's a 2 to 3 multiplier for investments in these capital spends in terms of economic development. So if there's $100 million that's invested, you tend to get 3 to 4 times that in terms of economic development. So 300 to 400 million in terms of economic development. So if I were to close, what am I saying? I see that a lot of really great work, and we just got involved in looking at this. I think Kisii has benefited from, obviously, SWED and the UK government being involved in this and funding studies and development plans, the urban development plan, the master plan. But how do you now take that and implement that, operationalize that, and make it into a functional city? How do you invest and attract the capital to do that on a large scale? I mean, if you add the healthcare city, then you're not looking at 100 million. Jamil mentioned 250. We think it's more, probably in the neighborhood of maybe $350 million. But then, you know, we would have to do the studies to kind of quantify that. So how do you attract that level of investment? How do you structure yourself to participate in that? Real quickly, the government of Kenya has been really great in terms of foresight in developing PPP plans that allows for public-private partnerships, that allows for this kind of attraction in terms of investments. So that's a great place to start. We would submit that Clarendon Global Partners with our collaborators and advisors could help to bridge that gap between the plans that have been developed and the implementation and getting that going. And Jamil asked, well, what is the outcome of what we would suggest today? And we would suggest that we get on that road right now, that SWED is still in country, that you have a lot of some of the thought leaders here. You want to start to think about that implementation plan today so that you can move seamlessly between plans and then implementation and integration into a new smart city. And we feel that Clarendon Global can be very helpful in that regard. Thank you very much.
Thank you, Marlon, for that explicit exposition of how we can develop that city and an integrated clean city. And friends, we have sat here long, and we'd like to have a short break. We're going to have our tea, but before we do that, we appreciate that we have had quite a number of speakers who have taken us through the background and where we are, and we really need to appreciate them. And we are just going to have a short break of 15 minutes. Our tea will be served just out here. We walk down the stairs. The tea is there. We can mingle and interact, and kindly stretch. We are housed by the Department of Health, and yet we have sat for so long, and our bodies are not meant for that. So there is a song that says showers of blessing, and we want to give our facilitators, the ones who have spoken, showers of blessing in terms of an applause. How do we do it? Showers That is instructors general. Showers, showers, raindrops, raindrops, thunder. All right, okay, let's go. Showers, 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 raindrops, 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 thunder. God bless you.
Sorry, before tea, one of the professors in the UK wants to say a word. Sorry about it, because we were a bit late in time. I think Professor Keith Brennan, Dean of Internationalization at the University of Manchester, wants to talk briefly before we go for tea. Keith, are you available?
Brilliant. Yes, I am, Raymond, and it's lovely to hear your voice. I'm sorry for keeping you from your tea break for just a little while. It's ironic we're talking about teaching, and part of the reason why we haven't been able to travel and join you today, which we really would have loved to do. It's that time of year that all educators dread slightly. It's marking season, and there's an awful lot of work going on in the university here in Manchester at the moment to graduate our current set of students. And of course, the marking and exam boards are going through, and we're just too much heavily involved with that at the minute. So I just say thank you ever so much for giving us the chance to talk this morning. I will present for the Dean, Graham Lord, this morning, and I'll talk a little bit about what myself, Raymond, Onchari, and Rogers have been discussing, Bahati have been discussing as part of this health city, this health education, this Centre of Excellence for Health Education and Training. So am I able to share slides as well on the screen? Can I have slides shared, please? Is it possible to activate the slide sharing?
Go ahead and share the slides now.
Brilliant, thank you ever so much. All right, so you'll have heard, hopefully heard today a little bit about the establishment of the Kenya UK Healthcare Alliance. This was very much a request from your president, His Excellency Uhuru Kenyatta. We've had the distinct pleasure of meeting him several times over the last couple of years, and he's very much come towards us talking about the changing needs for healthcare in Kenya, recognizing that the deaths that occur from non-communicable diseases will exceed those from infectious diseases and maternal and newborn deaths by 2030. Recognizing that this increase in non-communicable diseases is going to require a real change in the healthcare profession within Kenya. He's also been emphasizing to us how that it's important to understand the diseases in the East African setting and Kenyan setting. It's really very clear when you start looking, and the area he's pushed us towards initially is in and around cancer care, but it's very clear that the cancers that you see in Kenya there are some that are distinct. The response of patients to treatment is different to people of European descent. So there's a real need to actually understand the etiology of these non-communicable diseases, whether it's cancer, whether it's mental health, whether it's cardiovascular diseases in that East African environment. So there's been a real push towards understanding the research for that, changing the clinical service that's needed to take care of these diseases, which are much more long-term and require care over a protracted period of time. To improve those clinical services, of course, there will be training of current healthcare workers, but actually also it's thinking about that next generation and that next group of healthcare workers, healthcare providers across the whole spectrum of different healthcare professions, and thinking about developing that workforce in the future. So through our opportunities to meet with His Excellency, this has very much been the emphasis of this, and this is the driver behind the establishment of the Kenya-UK Healthcare Alliance, being able to link organisations in Kenya and the UK to develop the solutions to these questions that His Excellency has been raising. And working both with colleagues in Kisii and colleagues in Kenyatta University, teaching referral and research hospital in Nairobi, we've started to develop a plan towards thinking about how we can support development of a cancer service. So part of this is about developing a comprehensive cancer centre in KUTRRH, supporting that centre to be able to network with the developing cancer centres across Kenya, and one of which I believe is to be developed in the very near future within Kisii County. I believe that the work is starting for that cancer centre there. Within that network is developing consistent practice towards treatment, to develop those clinical services within the current workforce that will be able to support that network and ensure that you get early detection, you get preventative work, start to treat cancers at earlier stages. And actually one of the things that we have seen is that, and through our discussions, is that 70% of all cancers in Kenya are detected in late stages, stage 3, stage 4, when treatment is tricky. And that's certainly the case for one particular cancer type, which is esophageal cancer. Because it's detected so late, more than 99% of the people that are diagnosed with esophageal cancer will die from their disease, and die from their disease within 12 months. So part of the plan is about setting up that comprehensive cancer service and being able to set it up such that it will detect the disease early and bring that stage of diagnosis to stage 1 and 2 when interventions can be done and curative care is possible. Part of developing that clinical service will also be about developing the research of the subject. If I return back to esophageal cancer, this was brought to us by our Kenyan colleagues. They said this is a serious problem. It actually causes the most deaths from cancer in Kenya. What's also clear is it's a different form of esophageal cancer or throat cancer than you see in Western countries, in Europe and in North America. It has a completely different etiology, which is not understood properly, and as a consequence, the treatments are poor for it. So there's a real need to research it. There's some real interesting ideas within Kenya that the disease is focal, which is arguing for it being driven by an environmental effect. And if we understand that environmental effect, then we have the potential to actually avoid it, remove it. so that we can reduce the incidence massively. So certainly one part of the solution that we've been talking about is this comprehensive cancer centre and improvements in clinical services and an understanding of research. But of equal importance, and actually the more I think about it, probably even greater importance, is thinking about training that next generation of doctors and nurses and pharmacists and all the other healthcare professionals that you need to run the service. We're talking about the deaths caused by non-communicable diseases exceeding those of infectious diseases and maternal and newborn deaths by 2030. That's only 8 years away. That is roughly the time to train a doctor. This is one generation of doctors. So actually there's a real need to get on with this now, not wait. This is a pressing need now to actually bring that workforce in. It's going to need action from now. The other thing that I would just want to pick up is that also WHO have been doing surveys to look at needs for healthcare professions. The one place where the needs are increasing is within Africa. This is in part down to increases in population. We've heard that earlier. But this increasing in needs is just putting a huge pressure on the system. And the WHO estimates is that the 40% of all of the deficits in healthcare professions worldwide will be in Africa by 2030. So again, putting huge pressure on the system to that importance of bringing through new healthcare professionals. So hence, I feel that this importance of the Centre of Excellence for Healthcare Education and Training is actually probably more important than the Comprehensive Cancer Centre when I think about it. So talking with our colleagues like Raymond and Rogers and Anchari and Bahati, there's very much this idea of developing a Centre of Excellence with the healthcare campus or the medical city campus in Nicosia. It's a very broad development, and actually it's very interesting listening to Marlon Brown that actually many of the aspects that you're talking about, making it a much richer development than just a hospital and a medical school are all part of the plan. So it fits and chimes very, very well with what you were talking about. From our point of view as the University of Manchester and the NHS trusts within the Manchester area, we are very much looking forward to supporting the development of education curriculum within that medical school, to develop that medical education curriculum that's needed to make that healthcare workforce that will be able to cope with the increasing incidence of non-communicable diseases. And actually, when we think about this going forward from 2030 to 2040, patients that have multiple non-communicable diseases, so not just one, but 2, 3, 4. We've absolutely discussed the ability to license the curricula from Manchester, to use the curricula, but we've always talked about this as maybe that's a starting place. And again, the more and more I'm involved with this project, the more and more I listen to this, actually I think this is a very much a starting place, and then we can actually develop it and produce a curriculum that will work going forwards. I'm very conscious that when I look at this as a problem going into the future, there's an awful lot for the UK to learn in this process, as well as supporting the Kisii University. There's much we can learn back to actually make the curriculum work much better. A very good example of this is thinking about the use of digital records, medical records within the system. That's not present inside our degree program at the moment. When we look at redeveloping the curriculum with our colleagues in Kisii, this is something that should go in. And there's a huge opportunity in Kenya to actually bring this in with an open field of looking at how we can use those data records, how that can feed into research and understanding whether treatments work, how it actually looks at outcomes of patients. There's a huge opportunity there, and there's much that we can learn from this as well. The other thing that we've also emphasized, and I would emphasize about this, is that when we've been involved in these development of curricula with other universities, we have seen really strong ability of those universities to recruit international students to their campus. These are fee-paying students, significant fee-paying students, which actually makes the whole process financially sustainable. It brings a lot of income in very, very quickly. So not only does it allow the development and change of curricula, but it's very much a revenue generating process. And I think that fits very much with what's been said in the previous two talks. I think I want to finish by saying we're very much ready to get this going. We'd love to get started with this and start moving with the development of the curricula within the next academic year, and really get this forwards, make it happen, and start to see the differences in Kisii going forwards. I will stop there because I realise I'm preventing you from getting to your tea and your stretch, which we should all do. And I'll say thank you very much for allowing me the time to speak this morning on behalf of the University of Manchester.
Thank you, Kit. Thank you, Kit, for your remarks. Yeah, I think now it's time for tea, but we shall be a bit orderly. I would want the people in the front here, I'm not favoring anybody, but to start fast, and the next two rows, then the next two rows as we go, so the rest will remain seated. Maybe our dignitaries can now stand up. And then this side too. Then we, just like the soldiers do when they are doing roundabouts. Or about turn. Downstairs, let's go down.